So, hi everyone. We're here today with Neil Prose, who many of us know as a leader in the field of global health and pediatric dermatology. And I've asked him if he could talk a little bit about the way in which his global health experiences affect the way he takes care of patients worldwide.
Thanks, Sarah. That's a great question. I think that it affects it in several ways because a lot of the communication we do in our clinics every single day are various forms of intercultural communication, whether we're divided from our patients by virtue of race or gender or nationality. We are often communicating across cultures. And one wonders kind of what are the ingredients to make that possible and be successful. And I think that for myself, my discovery has been that it's not about memorizing the characteristics of every individual culture that you encounter, although that information is sometimes useful, but it's more about an attitude. And the attitude, I like to call it empathic curiosity, which is to say, approaching every patient with an open mind and trying to understand them as people. There's no way you can know everything about the background of the patient you're seeing. But if they're immigrants, for example, there's no better way to connect than to just have a conversation about their lives before they became immigrants. Just to kind of talk about where are you from, and tell me more about that, and is your family still there? And I would add one more thing with that. One of the things that helps me to make those connections even stronger is just simply reading the news every day. Because if you have a patient from Sudan or from Ethiopia or from South Africa, from Chile or from Vietnam, and you're able to say, I know there was an election last year and it was very difficult, or I know things are very hard or dangerous right now. People are amazed that you know that much about their country, because I think the experience for most immigrants is one of anonymity. It's one of a lot of people not taking an interest in their origin, in what their lives are about or what their lives were about before they came to this country. So I think that way of connecting is really valuable. And I think that it helps us to care more about our patients, because I think when you walk in the room and you meet a patient or a family for the first time, the way you imagine them is largely based on your own biases. It's about the way you consciously or unconsciously stereotype them. And the only way to get past that is with curiosity. There's a wonderful article by Faith Fitzgerald on curiosity in medicine. And in the article, she says, curiosity transforms strangers into people we can empathize with. And I think that's really, really true. And I think on a good day, when we're really manifesting curiosity, we can make such wonderful connections. And you go home at the end of the day feeling very like you've delivered really good care. And that's, to me, it's sort of like what this is all about.
I love that. Yeah, thank you so much for sharing that experience and that perspective, and also for sharing other aspects of your experience, which we'll be sharing in the newsletter. I really appreciate it.
My pleasure. Yes, thank you.